Okay, welcome everyone to another Fit Drivers podcast brought to you by our great sponsor, 10th Street. They've been with us for over 3 years now and really appreciate their support, allowing us to bring this kind of information out there to carriers and everybody that's involved in the transportation space. Today's going to be a pretty unique conversation. I've got two folks on here that I'm anxious for you to meet and hear from, and a company that I was introduced to. And I want to say before I get too far into it that in my previous life at Rolling Strong, when we had coaches, we came across this challenge all the time about when we're coaching drivers, and a lot of them don't understand about the benefits that they really have with their health plan. And so the company Medefy that you're going to hear from today, this is what they do, and with great success. I mean, they've got some phenomenal success numbers that I'm sure we'll get them to share with today. So I have two guests on with me today that I want to bring on here. So we're going to introduce Sandy and Adrian to the podcast today with Medefy, and so I'm excited to have them on. I'll give you a little brief introduction with these folks, and then we'll let them jump in and talk about it. But, you know, first of all, the mission statement for Medefy is they believe healthcare is often too overwhelming, complicated, and impersonal. That's why Medefy's mission is to make it easier for everyone to access, understand, and use their health benefits. Sandy, her career has been driven by one singular vision, and that is to uncomplicate, as she says, the healthcare world. With over 14 years of experience, Sandy has really done a phenomenal job of moving up into the ranks and working actually in the transportation manufacturing sector. And that allowed Sandy at one point to evolve into a senior leadership at Kaiser Permanente. And her co-worker in her with us today, Adrian, brings a member-first perspective to healthcare navigation, combining technical expertise with a passion for helping people make sense of often overwhelming healthcare system. They're able to work directly with the members to simplify their benefits and remove the barriers that they have to get their guide and also their individual towards right healthcare decisions and make clearly and with confidence. So, welcome, Sandy and Adrian. I appreciate you being on today.
Thank you, Bob. Yeah, thank you for having us. We've been looking forward to this event because, you know, I've been following you and tracking you, and you know, we believe that fleets are spending a fortune at the front door to recruit drivers, and while, you know, the back door is left wide open because of health and burnout, you know, we're here to partner with the transportation industry and with those companies that want to shut the back door by treating the drivers as a core business strategy. So it's an honor to talk to your audience today, Bob. Thank you so much.
Right on. So let's get into it. There's a lot that I know we're going to dive in here to today. And but what I like to do is in these podcasts is, you know, when I have special guests on like you folks, especially this is such a unique solution solver that you bring to the transportation space. Tell the audience more about your model and how this started, and also like to really hear some of the success you've had.
Yeah, absolutely. The company was formulated by two gentlemen in Tulsa, Oklahoma, who felt that the industry and health benefits in general very complicated, and they themselves couldn't find the resources that they needed. And Medefy was born. Medefy is a live benefits navigation platform that is driving the industry in leading an engagement, right, and guiding members to low cost, high quality care decisions. It sounds really simple. It seems very complicated in the healthcare industry, but at our core, we combine advanced technology and human expertise in making healthcare accessible for everyone. So we believe, to echo what you said earlier, Bob, is that it's way too often that we feel overwhelmed, complicated, and healthcare is very impersonal. So as it stands today, Bob, and for your listeners here, members, let's just say people today live in a world where everything is on demand. Most people, they lean on their mobile app, as a first approach to look for instant responses in every aspect of their lives, right? So we also know that there's a generation that uses technology a lot, and then other older folks are also using it. So the communication patterns are very, very different for all the folks. So whether an example that I always bring to surface is in healthcare, or let me back up before we even get into healthcare. In everyday living, we are used to the one-click environment, right? Whether we're shopping online and we want the package delivered today, or we want it tomorrow, or whether we're looking for plane tickets same day, next day, or concert tickets, most people lean on their devices to get that instantaneous response. And what's happening is, going now into healthcare, sometimes people are leaning on their devices and think that Google is a doctor, and they'll ask for Google support. I'm sure you've done this, Bob, right? Where you've gotten something from a physician, or you're unsure of a diagnosis, and you go to Google and you're like, what's this? What's the treatment, right? So we're trying to capture that momentum and bringing healthcare to now where people are ingesting healthcare as they are today, right?
Hmm.
I mean, I think you have leaned on your device, I'm sure, Bob, in terms of how you interact with it, right?
Exactly.
Yep. So
I'll
what we're
do.
doing is bringing our benefits to 2030, or to where people are today, and making it so that healthcare benefits can be engaged from a digital perspective, right? So what Medefy has found is that most employers rely heavily on awareness and communications, right? However, that's not really the problem. The problem that Medefy has found is that there needs to be a behavior change where people are being prompted to engage with benefits and motivate them to find easily accessible information, and then they will act upon that, right? So our mission is to remove the barriers where people find overwhelmed, confusion, they don't know who to call, they don't know where to go to find information, right? Medify's mission is really to deliver that simple approach to members where they get a better understanding of their benefits, and have better access to that.
So tell me, when you contract with a company,
Mhm.
are you working with the HR and compliance department? I mean, who is your main go-to department that you're working closely with?
Sure. Yes. We work directly with HR consultants. I'm sorry, HR individuals, directors, CHROs, sometimes CFOs, as well as consultants in the business. Many a times these companies just are looking for strategies in order to boost up engagement, or looking for cost containment strategies as well.
So do you work? I know a lot of these companies, they have like a locked-in insurance company or McGriff and so forth that manage their benefits, right? And a lot of times they end up being the gatekeeper, and you have to go through their front door. Does that happen in your business model as well, that you have to work with those folks?
Yes, indeed. We are a consummate, networking with those individuals to bring the brand and the company to surface, really expose our services to those gatekeepers and those individuals that really are the pioneers and the anchors that help the companies make these decisions, and what kind of points, which solutions they want to bring in, and what's really making a difference and an impact for their employees and members.
So what happens, though, I like to kind of go break it down, like step 1, 2, 3. So you sell ABC Freight, right? And they come in. So any HR directors are listening out there today. I'm sure part of your goal too is you want to make the load very light for them to lift. Is that correct? You want to take a lot of that off of them. The reason why at the end of the day, a lot of the employees struggle getting information because HR now is wearing so many different hats. So you want to lighten the load for them, right? So when you go in and you get this opportunity to work with this particular company, what's the first thing they do? They have to upload you a file of the people that are active in the benefit program?
Correct. So the implementation process is, we try our best to make it a frictionless environment.
Got it.
We work with those individuals that are the innovators, that are proactively looking for the best solutions for their employees and members. And what we do is we work together collaboratively with the HR team, the consultant, our data scientists, our solution engineers, and we implement our solution within a certain time frame, right? We strive to implement within 60 days. And once we implement the solution, then we're off to the races. And we're here, Adrian is here, and he can really talk to you a little bit more about how we engage with those employees and those members and really bring to life what are our successes, what's the key to our success, and why we're here today, because we are here to really make it easier for folks to engage with our solution.
Perfect. So Adrian, is your department then the folks that reach out to the employees and say, hey, introduce yourself, whatever the dialogue is, and that I'm here to help walk you through your benefits you have to make sure you understand them and how to take advantage of those? Is that what your department does then?
Yeah, that's exactly right, Bob. From my side of things, I'm there. I usually connect with members after they've already hit that roadblock of healthcare. You know, drivers are busy. They're trying to make deliveries. They're away from home. And the last thing they have time for is calling 3 different places just to figure out what they're supposed to do next.
Right.
So that's usually when we hear from them. They'll send us a message through the app, or they'll start a chat because they're stuck and they just need someone to help them figure out what that next step is. So maybe
excuse me, I forgot that key point. So part of the implementation, when you get a company set up, you deploy an app to these employees right away. That's the communication trigger.
Correct. Yep.
Okay. And they're instructed then to download the app. So here's something that I kind of put you on the spot here, but I think you're up for it. So let's say you got 500 employees, right, that you're taking on. And so right away that you're going to deploy this app to these 500 employees. What has been your rate of engagement that you're able to, if you get 500 employees and you deploy that app out there, what kind of percentage rate uptick are you going to get for people to really open it up and start activating it?
So this is surprising. And I have to say, I personally am always very just hesitant to release such numbers. However, I can proudly say that Medefy reaches anywhere between 22 to 45% engagement. Wow. Right? We're talking about the first 6 months of rolling out this solution to a group like 500 employees. The key has always been, Bob, is ensuring that we make it easy for them to access the information they need, whether they know they need it at that time or whether they will access it at a later time. But having that, again, thinking like those online shopping companies that people are looking for things instantaneously, it's having that human approach where we're touching those individuals in our best practices at a certain cadence that will trigger them to engage with our solution. And we've seen 22 to 45% engagement in the first 6 months.
And so I'm assuming that after that, it grows. A lot of it is just word of mouth, other employees talking to other employees saying how that it's benefited them, made it easy.
Correct, because in any working environment, if someone has, for the most part, if someone has had a good experience, they will share that information with their colleagues. To know that if your wife or your significant other is on a sports field and your child has an accident, you don't know what to do. You panic. You reach out to your husband or your wife or your partner, and knowing that you can find the resource quickly and promptly, that makes a huge difference than sitting on the phone and making 45-minute phone call and still not have the resource that you need.
Sure. So Adrian, back to you. With your department reaching out, so when you're going through this, is this a constant, like weekly or bump to really continue to get people to get engaged? Or how often do you resend that message, that information, or reach out to them?
Yeah, absolutely. We have they let us know that there's engagement messages going out every week. We want to make sure that everybody knows that we are here to support them with whatever they may need. Maybe that's finding urgent care while they're on the road, transferring a prescription to a pharmacy in another state, helping them understand a medical bill, or finding a new primary care provider that they feel confident in. And if they need help finding care, to touch on what Sandy said, if they need help finding care for a spouse or a child back home, we're there for them too.
Right.
So even though every situation is different, our role is always the same. We make that next step easier. Instead of spending their time trying to figure out who to call or where to go, they have someone they can reach out who's going to help point them in the right direction. And the easier we make that process, the more likely they are to get the care they need instead of putting it off.
So do you find that especially in the driver sector where they are hard to get a hold of, and with it being prominent male industry, even though the female sector is growing quite nicely, but do you have better success a lot of times getting a hold of the spouse at home or their teammate at home to get them to understand what some of these benefits are, to encourage whoever's on the road, he or she on the road, to get engaged? I mean, is that a form of your communication as well?
Yeah, absolutely. The app is available for both the driver or the spouse back home, or even the adult child. They can all message in on the app, and that's one of the things I love about my job, is that I can help anybody wherever they are, help them find the service or the help that they need. And I've been on the other side of it before. Like years ago, I was trying to figure out my own health plan, and I remember thinking, why is this so complicated?
Right.
I would have loved to have had someone I could just ask and get a straight answer from.
Sure.
So now I get to be that person for somebody else, and that's a really rewarding feeling.
So I know also too, in my experience working with a lot of the carriers, I learned early on, which I found very, very interesting, a lot of the utilization costs were driven from the spouse at home. Is that true that you find as well?
I guess it really depends. I wouldn't say that they're driving the high utilization. However, it seems that in some situations we do tend to communicate more with the spouse, right? They're more at home, they're more in touch with their children, there's more going on. Women's needs are sometimes different than men's needs. However, I wouldn't necessarily say it all leans towards a specific gender, let's say, right? It's more about just uncomplicating it and being accessible to those, right? And really, you touched on something that was really interesting before, Bob, was that male-dominated population. Sometimes they don't know that they need some help. So we will not only reach out, or we not only field questions, but we also prompt them by saying, have you gotten your physical? Do you feel good? Like during flu season, would you like, some guidance on getting a physic? So we also prompt with certain phrases or, questions where it could ping someone, and then someone could say, wow, yeah, actually I am up for my DOT medical exam. Maybe I'll answer this response and say, hey, can you help me find a physician? Right. Sometimes people are not proactive, right? So we try to make it simpler for them to engage. And I think that's another reason why we have seen so much success in that initial engagement period, is because we're also pushing out messaging that makes people think that maybe they don't need us today, but they might need us tomorrow or the day after or next week.
So also I wanted to ask this, that do you find that when you launch a company, is there ever cases when you actually go on site at that company when you launch to actually talk with people and talk with people one-on-one to get to really have conversations with them? Does that ever happen?
That does. There are some parameters that would be met, but yes, we are proponent and supporters of open enrollment, events, benefit fairs, because I think education is paramount, and it's really important to advise people of what they have. So we also do mailers. In the past, we've given air fresheners, right? And they hang from their rearview mirrors so that if something occurs, they could just flip it or scan it with the QR code. So we try to be creative in how the communication is pushed out in terms of This is a platform and a solution you can utilize, and it's an interface that's easily accessible through your mobile device. But we do encourage supporting organizations during open enrollment for sure.
Okay, Sandy, maybe this is a question for you. So how do you prove to the company the value in what you do, and to show that, of course, everybody wants to see the ROI, right? If they're going to bring on a company that to do what, they would hope that they were doing, but don't have the manpower or the staff to do it, how do you show their rate of return?
Sure. When we start out the first year, we let the corporations and the companies know, look, there are best practices that we already know are proven out to work. So long as we come to an agreement that these best practices can be implemented in terms of our communication strategy, if we do not meet the metrics that we propose we will give in terms of an ROI or ROV, because it's a holistic value, it's not just financial specifically. However, if we are to give a holistic value, within the first year, if we do not meet those metrics or those KPIs, then we will reimburse the cost of our solution to that employer. So we will reimburse them the money they invested in us.
And how often do you, when you do launch, you provide that company with like a portal or a dashboard of some sort that they can go
Correct.
up on and
Correct.
they can check it out?
Yep. And not only that, but depending again on the cadence and the size of the organization or the ability to communicate, we also will give a quarterly report. There is, some companies, when they're rather large, they want to just make sure that we're on the right path to success and want to be kept up to speed as to what we're doing. It depends on the organization and the bandwidth, but we definitely inform the employer of our performance, based on, again, a 2-month cadence, 3-month cadence, quarterly, just to let them know these are the numbers of engagement we're seeing so far and the impact we're making in terms of, redirecting the members to, let's say they went to the emergency room, or they traditionally would go to the emergency room, where now they reached out to us and we're like, hey, there's a physician or a provider a mile or two away from you. It's zero cost. It's no cost to you. Here's 3 numbers. Why don't you reach out to these people before you rush, because you can't find the services you need, to the ER. So then there's also those kind of savings. So there's a bunch of ways that we really try to work with the employers and the consultants in showing the value of what we do.
So Adrian, I think this is a question for you. Can you tell me 1, 2, 3, top 3 benefits that people seem to always have the biggest questions about?
Yeah, absolutely, Bob. One thing I've learned about working with members is that they usually aren't reaching out because they want to learn about their benefits. They're reaching out because something happened and they need help figuring out what to do next.
Okay.
One member I worked with was having trouble getting their prescription. They had already talked to the provider's office, then the pharmacy, and they kept getting different answers about where the prescription had actually been sent. And they were very frustrated because every conversation they felt like they had to start over. They call in, they get the machine, they got to press the numbers until they finally get to somebody and talk all over again. So we stepped in, we worked with everyone involved, and we got the prescription transferred to the pharmacy that they wanted to use. And we stayed with them until everything was squared away. And, it sounds like a small thing, but when you're already dealing with a health issue, not having to make 5 more phone calls makes a huge difference.
So if I understand this correctly, so you're just not giving them the number or who to call. A lot of these cases, you're actually doing the legwork for them and chasing this down, like you said, for example, and find out where this script ended up at and how you can get it in their hands.
Absolutely. If that's we work on making this the smoothest and easiest process for them. They just need to say, hey, I'm having trouble getting this prescription. We get their information and we can get that sorted out for them. Let them know exactly where that needs to go.
Well, I like I said, not really having the in-depth experience that you folks have, but I can tell you that from limited experience I had, there was a lot of great gratification and seeing people relieved that they didn't realize, one, maybe they had this benefit that they didn't think was part of their plan. And they thought they were going to have to pay out of pocket, and they were very relieved that they did have a plan that they could take advantage of. Or they didn't know what the grace period was. That was always a big one that we found out. I said, well, have you talked to HR? And they said, well, they just assumed that because some of them I've seen it. Some of them, it's like you get hired on, and it's sometimes anywhere from 90 to 120 days before you're active, right? But not all of them are like that. A lot of them, it can be activated within 30 days. So a lot of them just assume it's going to be a 3 or 4 month period. And here they are in need of some service, and they're not activating it. So,
and I think that's another thing, is that knowing the nuances that are important for each employer and reaching out and messaging those drivers is really important, because that allows us to really then, incorporate our communication strategy on sending out message of, do you know when your grace period is up, right? It's a generic message. However, it would prompt some sort of engagement, right? And to us, you asked Adrian, what are top 3? It really varies from organization to organization, right? That's a great example, though, of how a good communication strategy can work, and thus it will then trigger someone to engage in the solution. And again, another reason why it validates our engagement numbers is because sometimes the messaging just resonates with that individual, and they could be very far away from home, and something could happen, and then next a message comes in, and then it resonates for them, right? And the same message could be reached to their spouse or their adult child, like Adrian has shared.
Well, I know that when we were coaching, multiple companies, one of the first things I would explain to the HR people that they're going to see is they're going to see an increase in their prescription usage, which you want to, right? I mean, because we have drivers that, especially because, blood pressure is number one thing that takes them off the highway and puts them on the bench. So when we start coaching a driver, usually 7 out of 10 drivers had high blood pressure, and the first question said, have you been prescribed medication? Yes. Are you taking it? No. And so the first line of defense was, you got to get your meds, because you have to take it so we can get your results a lot faster if you're on your medication. So they instantly, because I learned this once again early on, HR called me and said, gosh, Bob, there's a huge spike in our prescriptions and our medication. I said, yeah, absolutely. That's a good thing. Because now we know drivers are, instead of not taking, and that maybe you've learned this already, but drivers are famous for 30 days out before they go take their physical, they're taking double doses, right? More is better. And they're taking it, and they haven't been taking it because most of them don't want to take it. And this was the other thing too, in counseling, and I'd be interested to hear from Adrian if this comes up, that a lot of the drivers, I don't like the way it makes me feel.
The side effects.
Yeah. And then we need to get you to see a doc so we can adjust your dosage. That's got to be a huge benefit for what your team could do for them. Is that true?
Yeah, absolutely. Getting back in and seeing a physician is definitely one of the messages that members will come in with. And I can think of a time where we had connected with a member where they were frustrated with the care that they were receiving from their primary care doctor, and they asked us to help them find another provider. They shared, and I remember this message. They said they were extremely unhappy with the efficiency and service of care they were receiving. So we pulled together several network providers with stronger quality ratings and patient reviews, along with office locations, phone numbers, and estimated costs, so they could compare everything in one place and choose a provider they felt most comfortable with.
Yeah.
And it made the decision a whole lot easier because they didn't have to spend hours researching everything on their own. They had it right there for them. Well,
and a lot of times drivers too, because they think that if they because it doesn't make them feel right. And they don't want to take the time to go back to see a doctor, get it adjusted or whatever. They think they can explain that in their DOT exam and it'll be overlooked. And that's not the case. It's very clear. Either your blood pressure is what it is or it isn't. And a lot of them also too, I mean, things as simple as this, they'd be waiting to go in to get their exam done. And of course, one of the first things they do is their blood pressure, and they're standing outside smoking. Because they think smoking calms them down.
Mhm.
And they don't realize that elevates your blood pressure. I mean, just things like that, just simple education. We had little guidelines that actually like menus that we gave them to do and follow, 30 days out before they did and the day of, to make sure that they weren't standing outside smoking or pounding drinks or, or eating high sodium foods and so forth the night before.
Yeah, I think that also what happens with this industry specifically and the drivers, not only do they struggle in finding services or locating a doctor, but they're constantly on the road. So they then don't think that they can get the services rendered. If they're traveling to a destination, they potentially could have, a listing of physicians that are located at the destination that they're headed to. So knowing that they could, chat with someone to try to frame that and set that up for them is also really helpful. And, again, it's trying to keep the drivers healthy and engaged in their plans and in their healthcare, because these HR individuals and consultants were really hard to give them great benefits, but a lot of people just don't know what they have.
Yeah. Well, I can tell you, as I've said in many roundtable discussions with companies, HR and their insurance reps, and the HR folks are saying, you got to do something about these rates. You got to get these rates down. We got to quit hiring all these unhealthy people. But it just goes around and around. And if you don't have programs in effect that can really help people make better choices, because, I've been involved in this space all my life. And, when you go to school and learn to be a truck driver, telling you how to make better choices out on the highway is not number one on the list.
Nope.
It's not even on the list at all.
Yeah.
And you know what the sad thing about Sandy is it's just not the trucking industry. I mean, individuals in general, right? Doctors and so forth, don't do a good job of explaining to you how to live a better health lifestyle.
Yeah, and it's hard because, again, we could go into and dive into, to your point, make better food choices, but at every truck stop it's a challenge, but I also like how you have also talked about doing the physical working out, the sit-ups and the push-ups and the jumping jacks, and just try to stretch and do those things. There could be a messaging of communication strategy. Have you stretched your body today? Have you thought about, there's just so many things that I think that, again, these HR and consultants individuals that work so hard in building these communications and building these plans, the messaging is just not reaching the folks, right? Yeah. And we want to make it easy so that the communication is being reached, and we are trying to make an impact, and we are trying to get them to engage in their plan. And so there has been spikes at time, Bob, where we've had employers say, whoa, this cost is going through the roof now, because to your point, all the prescriptions are getting filled and they're seeing a lot happening behind the scenes. So we also have had that where they're like, okay, we need to recalibrate and see how we're going to handle this, Right. So there's positives to it all around, but ultimately our goal is to just really work with those drivers that deliver all the wonderful things that we get every single day. And we're so appreciative of all the work that they do.
Right. Well, if you ever find the need, if you like, when it comes to the transportation, I got plenty of collateral materials, education materials. We're glad to, pass on to you for you to use if you like to be able to extend to these folks when you're meeting with them, and just simple steps that they can do, small steps with big results. So
I'm sure Adrian would be thrilled to read that information.
Yeah. So, well, listen, this has been a lot of good information. I really appreciate you folks coming on, and we'll get this packaged up and get it out, and we'll make sure your marketing team, they sent over a link that you want to have on there so we can kind of identify.
Absolutely. Yeah, absolutely. if anyone's interested, they definitely can visit our link that's posted here. It's www.medefy.com. I think to your point, our marketing gal did send over some information, and we're here to help the industry and help the drivers access the care they need, and for their family. That sometimes the distance makes it quite challenging to access information, and we want to be that resource for to help the individual as well as help the employer with their cost containment strategies.
Sure. Well, I certainly believe in what you do, and like I said, having firsthand experience at it, and I'm going to do all I can to let more people know about what the service is and what it can do for their company, and more importantly, what they can do for their employees, given these benefits. So thanks so much again, and we'll get this out.
Thank you, Bob. It was great talking to you, and good luck to all the drivers out there. Stay safe.
Right on.
Thank you, Bob. Thank you for having us.
You bet. Thank you.
All right. Bye-bye.